Hello, Assalamualaikum. I'm Dr. Sindhu, Mrs. Bisma. How can I help you today? Okay. Tell me more. I'm very sorry to hear about that, Mrs. Bisma, and I understand that how difficult situation would be for you. But to better understand your condition, I need to ask you a few questions. Is it okay with you? Thanks for your cooperation, Mrs. Bisma. So, Mrs. Bisma, is this your first pregnancy? Okay. All right. So, if there is any vomiting along with that? Okay. You don't have any vomiting, but you feel nausea. Okay. Mrs. Bisma, have you noticed any change in your in the color of your stool? And how about your urine? If it is an adequate in amount? And may I know the color of urine? Okay. If there is any burning while urinating? All right. Mrs. Bisma, have you noticed any changes in your appetite? Okay. If there is any fever along with that? Okay. When you felt warm, did you have any chills and shivering along with that? May I know the pattern of fever, if it is continuous or comes and goes? Any particular time? Okay. Mrs. Bisma, if there is any abdominal pain? No? Any abdominal pain after meal? Have you noticed any changes in your bowel movements? How about your bowel movements? Okay. If there is any itching on your skin? Have you noticed any change in your weight? Any weight loss? Weight gain? All right, Mrs. Bisma, have you ever had similar symptoms before? If there is any history of blood transfusion? Have you traveled recently? Okay, when? Month ago? Okay. All right, Mrs. Bisma. So, have you started any new medication recently? Okay. Taking any medication prescribed by doctor over the counter? Okay. Have you ever had any surgery done? Any dental treatment? Do you have any long-term illness? Okay. If there is any history of health problem in the family? Any immediate family member suffering from some symptoms? All right, Mrs. Bisma, I'm going to ask a few personal questions. Is it okay with you? Yes, Ms. Bisma, let me reassure you that the conversation will remain confidential between you and me. You need not to be worried about that. Is it okay with you? Yes, Mrs. Bisma. So, do you smoke? Any alcohol use? Does your husband have hepatitis? Okay. And please don't mind, Mrs. Bisma, if there is any sexual relationship other than your husband? All right. Yes, Ms. Bisma, I had to ask these questions. Okay, so don't mind, please. Okay. And thanks for your cooperation, Mrs. Bisma. So, Mrs. Bisma, have you any worries about your condition? Yeah, I understand your worries, Mrs. Bisma, and you not to be worried. I'll try best of my abilities to solve your problem. If it makes sense to you? Mm-hmm. All right, Mrs. Bisma. So, have you been following up with anyone for your pregnancy? Mm-hmm. And how's everything is going well at the end? Mm-hmm. Okay, Mrs. Bisma. So, in order to better understand, I need to examine you. Is it okay with you? Thanks for your cooperation. Could you please come on the couch? Then I'll sanitize my hands and let them dry. And then I start from general physical examination. I'll check the conscious level, orientation in time and space. So a patient was able to give history and everything, and she was aware. So there is no need to check a conscious level, orientation, time and place. She already knew it. So I'll start from the hands, palms for sweating, any cyanosis, any contracture, and palmar erythema, and then nails for clubbing colonchia, and then I'll check the pulse for rate and rhythm, and BP for hypertension or hypotension. And then ask patient to look up. Mrs. Bisma, could you please look up, look down, show me your tongue, lift your tongue behind your upper teeth. Mrs. Bisma, can you swallow? Okay, then from back, standing back, I'll examine thyroid. Mrs. Bisma, could you please swallow? And then I'll check lymph nodes for lymphadenopathy. And then, Mrs. Bisma, does it hurt anywhere? All right, and then I'll do abdominal examination, light and deep. Mrs. Bisma, I take a deep breath in, exhale, and take a deep breath in. Okay. Then I'll check the shins for any edema. Thanks for your cooperation. And then at the end, and while examination, I'll check a skin for if there is any scratch marks. Thanks for your cooperation, Mrs. Bisma. You can have your seat. So, Mrs. Bisma, based on your symptoms and checkup, examination I have performed, I came to the conclusion that most likely you are suffering from a condition what we call in our medical terminology is hepatitis. Okay, and do you know what is hepatitis? You need not to be worried, Mrs. Bisma. I'm here to explain it to you. Okay, it is an infection of the liver by a virus. Okay, and most likely hepatitis. Which comes from food, and it settles on its own in a couple of weeks. Okay, as you stated that you visited a village recently, so maybe you got it from there. Okay, so I'll suggest a few investigations. Okay, is it convenient for you, Mrs. Bisma? All right, Mrs. Bisma, before I order these investigations, let me confirm it from you that have you undergone an investigation so far? All right, then Mrs. Bisma, I'll suggest LFTs, hepatitis A IgM and hepatitis E IgM to confirm hepatitis. Okay, and besides that, I'll encourage you to take some rest at home and do whatever you can tolerate easily. Okay, no exertion at all. Okay, eat whatever you feel like eating. Just avoid the food what makes you feel nauseated or make you vomit. Okay, you can eat everything. Okay, if it makes sense to you, Mrs. Bisma. Yes, Mrs. Bisma, if you feel nausea or vomiting, I'm prescribing a tablet metoclopramide, okay, 10 mg. You have to take it 3 times a day, okay. And if you have a fever or body ache, okay, so for that I'm prescribing tablet paracetamol. You have to take 500 mg 2 tablets 3 times a day, okay, and avoid all other medicines including vitamins, if it makes sense to you, Mrs. Visma. Yes, this is Miss Visma, and besides that, I'll encourage you to keep your towel and soap separate, okay? And your glass of water, okay? Glass you are using for drinking water or cup of tea, okay? And besides that, I would like to see you again with results of this lab test. Is it okay with you? Yes, Mrs. Bismarck, please try and get plenty of fresh, take plenty of fruits, vegetables, plenty of water, okay? And you need not to be worried, okay? And if any point you start vomiting or run a high-grade fever, you feel abdominal pain or become drowsy, please go to your nearest emergency. Is it okay with you? Yes, Mrs. Bisma. And so, do you need any medical certificate for breast? All right, Mrs. Bisma. So, is there anything else you want to discuss with me today? All right, Mrs. Bisma. See me as soon